Hello and welcome everyone. I'm Ashima with OnePal. Some of you may or may not know, but October is National Domestic Violence Awareness Month. And in light of this, today I'll be talking about domestic violence with Mehtab Kaur, who is a clinical counselor with the Atlantic Counseling Group. So Mehtab has worked previously, she's worked with children, adolescents, and adults in private practice settings, as well as court-mandated psychoeducational groups. She focuses on areas such as transitional phase of life, maternal mental health, anxiety, depression, grief, individual and or couples counseling, and relational issues. Additionally, her interests lie in intergenerational trauma, domestic violence, social justice issues, and women empowerment. Hi, Mehtab, and thank you so much for being here with us today. Could you share a little bit about your background and what it is that you do?
Sure. Hey, Ashima, I'm glad to be here today. Thanks for reaching out to me to be a part of this and share a little bit about what I do. So a little bit of my background is was born and raised in Virginia. I am a first generation Punjabi Sikh in the United States, and I've grown up here my whole life. I recently just graduated from grad school in May, getting my master's degree. Thank you. Getting my master's degree in clinical mental health counseling. I have a bachelor's in psychology, a minor in the history of public health. So I've always kind of been drawn to this topic and this area of expertise, if you will. So I've always wanted to kind of enhance in the field, and completing my degree has allowed me to have really good experiences, even while I was in school and afterwards, to work with the domestic violence population. I have worked with offenders and I've worked with victims. It has been a blessing in disguise to work with this population, as my own background in my childhood years, adolescent years, and adulthood have included phases of domestic violence, in which I grew out of, but at the same time, those are some things that are really hard to get over, move through, and grow out of. So it all kind of intertwined together, and here I am today, working with these populations, as well as anger management issues. Mm-hmm. So they all kind of go hand in hand, and mainly why I was attracted to this field was because of this stigma that I wanted to kind of break, of domestic violence and mental health in general.
Yeah.
How can I bring that forward in my community and give back, while also being able to educate others, just sharing a little bit of my experience and a little bit of my existence on this planet, for the short time that we're here.
Yeah.
And how can I help other people? So that's a little bit about me. When I'm not in the counseling field, I am a photographer and an artist at heart. So I shoot weddings and have a good time. I'm a very creative person, so I'll do art from time to time, and yeah, photography is my thing. So when I'm not in the counseling world, that's what I'm usually doing, or something creative. So yeah.
That's fantastic. I love that. And thank you so much for sharing that personal piece about yourself. I think it really allows the conversation to be more normalized, especially when people come forth, especially such as yourself, like practitioners and providers themselves sharing their personal bit. And so I really appreciate that. Do you think your personal experience was also a huge driving force in what led you down this career path?
Yeah. After undergrad, I knew that I wanted to go into the field of psychology and kind of advance there, as I did research in undergrad. And I was more on the medical side of things. However, I found myself applying for grad schools in different programs. I had no intentions of honestly getting into counseling per se, but more so just how can I be in the field and be a part of what I actually enjoy, and that is interacting with people and understanding why our behaviors are the way that they are. And I fell in love with the program simply because I went to Marymount University in Northern Virginia. It's a private school. It's a Catholic institution. It was wonderful. I was able to grow there, and I was able to enhance professionally and develop academically. And, I think it was the environment that I was taught in that kind of made the experience better. and it brought out a lot of qualities in me that I didn't know I had, you know, in order to be a good counselor, being able to sit across from somebody and actually be able to empathize with them and be compassionate with them. So in a nutshell, you know, I had no intention of specifically becoming a counselor. I'll be completely honest, you know, but I think my path just kind of led me to wanting to be I'm a natural empath. So I think it just led me to this direction on its own, and things unfolded in their own unique way. But initially when I was applying to grad schools, I did apply for more like research-based psychology programs and I guess more human development related programs, and less of counseling. This was the only one that that was counseling related. So I decided to just pursue that. And I was like, well, it doesn't look like I'm bad at it, so might as well keep going, you know?
I love that. Thanks for sharing that.
Of course.
So, just given the general misconceptions we have about just even the simple definition of domestic violence, probably because it's not so simple, but can you help define it for our viewers and just for the general public? What is domestic violence?
Sure. So domestic violence and interrelated with intimate partner violence is it's abuse of any action that results in harming another individual. So in a nutshell, you know, like that's a really broad statement that can be broken down into 5 different categories. So that could be physical abuse, that could be verbal, that could be sexual abuse, that could be emotional and financial abuse. So there's many different categories. And as we know, you know, the physical is related to actually physically harming somebody, and that's also under the umbrella of sexual abuse because it's all physical. Emotional abuse is more of the damage, the psychological damage that takes place, you know, such as entitlement, manipulation, constant degrading, criticizing, demeaning, demoralizing somebody. So that's what the emotional abuse looks like. Verbal is kind of this, it's similar. That's more passive aggressive, more of the yelling, you know, raising your tone at your partner. And the financial abuse is withholding funds from your partner, not allowing them access to credit cards, bank accounts, what have you. So it's all really related when you put it together. It's abuse and harming somebody in any form or way. And I think that's the best way to put it, really.
Okay, that was really, really helpful. I think, like I said, I feel like there's so many misconceptions about just general what domestic violence is. Automatically, I think a lot of people, and maybe really specifically in our culture as well, in the South Asian culture, we think of domestic violence as being purely physical, and it's so much more than like you just explained. So
definitely,
really helpful. And now, given that we understand the definition of it, what are the signs of abuse? And how can someone help if they suspect or know someone that is a victim of domestic violence? What does that look like?
Sure. You know, so the most telling sign of domestic violence is fear, or any domestic situation that you might feel threatened in. It's fear. So that's the most telling sign, and we often overlook that one. We brush it under the rug that, you know, nothing is wrong. Boundary violations are a huge sign of abuse, where your boundaries, your emotional, physical boundaries are constantly violated. Entitlement, lying, manipulation, isolation, intimidation, having to walk on eggshells around your perpetrator, your abuser being in the victim stance all the time, saying that I'm innocent, I didn't do anything. That's always a good sign or good indication that you might be in a domestic situation. And the abuser often encourages feelings of self-loathing for the actual victim. So these are just, you know, some signs that take place, and they're all across different cultures and backgrounds. So you know, you can tell that these are just very toxic traits and behaviors to, you know, put on somebody else. So these are the most telling signs, but fear being number one. If you don't feel safe in your relationship, you know, that's a great indicator that you might be in an abusive situation.
Okay. And what about for others looking from an outside perspective? Besides, I mean, it's often maybe, do you find that victims do a really good job of hiding the fear and everything that you're mentioning? Or is it pretty apparent and obvious for someone to recognize if you're close enough to the person? How does that?
It's always a hit or miss. I mean, it really just depends on the situation and the person and how open they are, vocalizing what they're actually going through. Picking up on the signs that I just talked about, it's a great way to start that conversation with somebody, especially if you have a good amount of trust with them. But the biggest thing you can do is never telling the victim to actually leave their situation.
Oh, wow.
So, oftentimes, and as being a therapist, my training includes never telling the victim to leave the situation. And why that is because 75% of the time, according to research, when the victim leaves, they're actually often in higher risk situations. So they're often severely injured or actually killed. So that poses a greater threat on them. So I think, to answer your question, how can you help somebody, is definitely picking up on those cues. It's called the believe model, which is the boundary violations, the entitlement, the lying, the isolation, the intimidation, that kind of stuff. So if you're picking up on those signs and you trust this person and they can trust you, I think that's a good conversation starter. People are very good at hiding these situations as well, with the fear of stigma and what will other people say, particularly in the South Asian community and other minority groups as well. So, the biggest advice I could give somebody is, never telling a victim of abuse to actually leave the situation without a safety plan. And there's plenty of help, you can get in order to take that step to actually leave. But I think sometimes when you take that step, you put yourself at greater risk.
Yeah. Okay. Even me, I did not even know that. So thanks for enlightening us with that, to never tell a victim to leave their situation because it may do more damage. Good. Okay.
Yeah, definitely.
And so shifting a little bit, how do you find that domestic violence impacts a victim from a psychological point of view or their mental health? And I'm talking specifically in terms of just depression, anxiety, specific diagnoses, and feel free to go even beyond that, the trauma, all that kind of stuff. So, yeah.
Sure. So, with domestic violence or any intimate partner violence situation, the emotional verbal abuse is oftentimes way greater than the actual physical abuse. And that's not to dismiss any physical abusive situations, but the constant intimidation, the belittling, the shame that takes place in that relationship is going to be far more damaging to the victim, to the actual victim. So there's severe damage to one's self-esteem, their confidence, their ability to be independent, their interdependence, and the ability to trust other people. So that these are just core factors of how one's psychological health can be impacted in a domestic situation. It can get very tricky because we often mask a lot of our emotions. So it's hard to pick up on these types of things, but hopefully that answers your question. In terms of diagnoses, depression, number one, anxiety, also pretty high up there. PTSD, any other trauma related disorders can take place. Relational distress, that's also another diagnosis. Intimate partner violence for offender or victim, those are also diagnoses in the DSM. So there's a lot of different, diagnoses with this, but the top two, I would say, or top three I can point is depression, anxiety, and PTSD.
Yeah, absolutely.
Yeah.
And in terms of domestic violence to be considered, I don't know if the proper term is, I don't know if you diagnose victims or patients with that umbrella of domestic violence, but what I'm asking is there a specific period of time that the abuse needs to go on for it to be termed this person is a victim of domestic violence or is living in a situation constantly that is. Yeah.
And there's many different ways to answer that. It really just depends on how much information you know as a clinician, and how much the patient is actually sharing with you and when that actually started. So, in therapy, I have to breach confidentiality if I suspect any abuse towards my client or or if they're abusing anybody else. So in those events, that's when you get law enforcement involved. That's when you get other help involved. Unfortunately, I'm not a crisis counselor, but I do know that it really just depends on when your patient has told you how long the violence and the abuse has gone on.
Okay.
So there's different layers to it, to answer your question.
Yeah.
But I know, for depression, it's 2 weeks time frame. So if you know that the person has been feeling severely sad, or that lack of confidence, then it's an indicator that they might be depressed, and especially if they're having trouble sleeping, their appetite is not good. There's a lot of different factors there, but depression, it's always 2 weeks.
Yeah. Okay, that was really helpful. So do you find that you see higher rates in certain age demographic or genders that are suffering through domestic violence or are victims of domestic violence situation?
So I work in Loudoun County currently, and last year when I worked with the domestic violence population, there were many different cultural groups that came in for domestic violence cases. And it wasn't just, white men or black men or white women, black women. It's I would say, according to my experience with them, it's fair all across the board in different minority groups. I would say it's something that is less reported in minority communities due to the stigmas. But I do know that according to research, domestic violence rates are way higher in minority groups. So that could include South Asians, that could include African Americans, LGBTQ, youth. So there's a lot of different groups there.
Yeah. Okay.